Hello. Hello, everyone. Good morning. And welcome to what we hope is going to be a very interesting talk today. Let's talk about BDA Scotland's involvement with our national plan, our reports that have recently been launched this week in relation to local authorities and the NHS and their services to deaf communities. It's lovely to see everyone out there tuning in today. We've chosen this topic because today is, in fact, the 6th anniversary of the Bsl Scotland Act 2015 being passed by royal consent. It was passed on the 17th of September, but it was this day, 6 years ago, when it achieved royal consent. Look at this. So the royal stamp. So we thought today would be the perfect opportunity for us to look back at our work and to look at the 2 reports that have been launched this week. So anybody watching today, you are very welcome to post any comments or questions in the chat, and we will hopefully be able to reply to you as we go along today. I'd like to introduce a couple of my colleagues. We also have spoken language interpretation, and we're hoping that it's working this time. But I'd like to introduce you now to my colleague, Helen Morganswenholt. Hello, I'm delighted to be here. My name's Helen, this is my sign name. And I've been responsible for looking at the 32 councils, local authorities across Scotland, and I'm looking forward to giving you more information about my work as we go through today. Okay, I'd now like to introduce another colleague, James Barnes-Miller. Hello, I'm James. I've been responsible for looking at the health boards and their engagement with the deaf community, all 14 health boards across Scotland, as well as NHS Inform and all of the engagement that they've undertaken with deaf communities. I've been working alongside my colleague, Helen. Well, that sounds fascinating. Okay, before we carry on, I would like to congratulate both of you for collating so much information from all of the authorities and health boards and producing those reports. Fabulous, don't they look great? I know that both of you have worked very, very hard. You've done a lot of not only face-to-face engagement or online engagement, but also a lot of translation. And in the last couple of days, you've been involved in disseminating the information from your reports. And I know that anybody who wants to find out more about those reports can look on our website to get more details. But I'm very, very proud of you, both of you, and the work that you've undertaken. Thank you so much. I'd like to just ask you some questions about the reports and about the information you've collected, about your engagement with the councils and the NHS boards, and your engagement with deaf communities across Scotland as well. So those are the things I'd like to discuss as we go through the session today. My first question to you is that you've created these reports, but why are they necessary? What's the point of these reports? Helen? Well, as you said, 6 years ago, we got the Bsl Scotland Act 2015. And I think in 2016, 2017, we came up with the Bsl National Plan. This is a copy of it here. Now, this document was the first plan. I mean, obviously, it was the first one, so there was some area of improvement, but it was the first one in the UK. And to pilot that, they decided that they would take it in 3-year phases. So really, the first phase should have come to an end last year, but because of coronavirus, that was slightly delayed. So the ambition of the reports is really just to look at whether the Bsl National Plan is working? Is it being implemented? How is it going? So I've been in touch with 32 local authorities, and James, over to you. Yes, I've been in touch with, altogether 14 health boards. I've engaged with them, I've talked to them over Zoom, I've talked to them on various online platforms to try and collate the information in the report. And the report is really looking at how we engage, and you should be able to see a link to the report here. There it is. There we are. So if people click on this report, they'll be able to see videos in sign language, that's right. And they'll also be able to read the reports in written English. Absolutely. The reports are available both in BSL and in English, and the information in both is the same. So there have been other BSL partners involved in this, like Deaf Action and others, and access to these reports is available through their websites as well, not just the BDA website. Also, the colleges and universities and so on. Okay, but let's go back to the idea of these reports. When we got the BSL Act, that wasn't the end of the story. We're kind of halfway now towards a 6-year review. So there was a kind of interim report, wasn't there? That's right. Now, at Christmas, you were both talking about that interim report. So what's the difference between that interim report and the reports that we're discussing here today? Well, the report should have been ready for October 2020, but of course it was delayed. So the most recent reports are an update, an additional update on that interim report, with more information about what councils and NHS boards have been doing since that interim report. So it really looks at what's been done, and what is still needing to be done. So these reports will be passed to the Scottish Government, yes. And the BDA at this point has to thank the Scottish Government for funding our project to look at and collate information about services to deaf people across Scotland and to prepare these reports. So that's great. So let's have a little more of an in-depth look at these reports and what they contain. The reports are really important because they contain evidence that has been collated from across Scotland about what has been done and what is still being done. Can I ask you how you both liaised with the councils and the NHS boards? How did you make contact with them? How did you begin to discuss with the relevant people, especially through coronavirus and lockdown, which can't have been easy? So how did you find ways of engaging with the councils and the NHS boards? Well, yes, if we go back to 2020, it was really easy, actually. We were meeting people face to face and making connections and making engagement. But of course, with councils, that wasn't always straightforward initially, because it was often very difficult to find who was the lead person. When I phoned the main switchboards at various councils, they didn't really know. And then we had coronavirus. But we were able to continue with Zoom and other platforms, so it's almost face-to-face. I think a phone is a little bit disengaged, it's a bit less personal, whereas online engagement, we were able to actually meet our counterparts in the relevant local authorities, and also they were able to get to know the faces from the BDA. And James, how was it for you? Yeah, I started this project in February 2020. That's when I started to be involved. So I began at that point to meet with members of NHS boards, and then of course coronavirus happened and that became much more difficult. So I had to switch tactic, and I began to meet people through online platforms. We used Zoom quite a lot, with health boards and interpreters, and we became quite used to that. And it was good because we were able to form personal relationships, see the face of the person you were engaging with. So we were able to push ahead with that. So you've managed, and was it easy to do Zoom with everyone? No, some NHS boards were quite reluctant to use those kinds of platforms. And we had to persuade them that these were platforms that were accessible to deaf people. Often their firewalls were very difficult to navigate, but eventually we managed to find a way, and we've made quite a deal of progress, in fact. And Helen, did you have the same issues? Absolutely, absolutely. Phone calls don't seem to be too difficult. But we've been able to use remote services and interpreting services, and we've been able to get through. Okay, so Helen, you've been responsible for engaging with 32 local authorities. Have you managed to engage with them all? Yeah, by 2020, I'd had 31 responses. I didn't have a response from Clackmannanshire, and that's because they had a difficulty with the staff there. So that's Clackmannanshire Local Authority. So not far from Stirling, around that area, a very small area in that part of Scotland. So they had issues with staff. So by 2021, I only had 25 responses. And that was because a lot of people, for a lot of local authorities, their response to BSL users had been delayed by coronavirus. And they're hoping to recover those services as we go forward through 2022. And hopefully we'll be able to support them in doing that and in achieving their plans. James, anything different from you? Well, we have 14 health boards. We managed to contact all 14 apart from one. We couldn't get any response from 5, and that was very difficult. So we've concentrated on the 13, and we've also added NHS 24, because NHS 24 provides online services to deaf communities. So we've had a look at their website and the health information that's available there. So we felt it was really important to also prioritise NHS 24 when we were looking at this data, and they're included in the report. And NHS Inform as well, I believe. Oh yes, that's right, NHS Inform. Yeah, and you can see the link here. And you can see there's a /BSL at the end of that link, and that takes you directly to health information that is available in BSL. You just click on that, and various topics are presented, various health topics, and you can browse through those and click on to activate information about stroke, for example, or diabetes. So you'll find a lot of information there. There's a lot of resources, and I hope that that's very helpful to viewers today. Obviously, there's been a greater focus on health because of the coronavirus pandemic. So it's been more important, hasn't it? Does your report reflect that? And I'd also like to talk about the data itself. I mean, that's been collated from the 24 boards, and obviously there's a lot of statistical work and data management there. Helen, you were saying you have data from 31 councils. That's right, yeah. But this year, we've only been able to collect data from 25, right, because of coronavirus. And James, you've got the 13 NHS boards. So in both cases, we've got more than half of the total responding, which is really great and shows a great deal of motivation and interest. I'd like now to turn to the idea of, well, I know that, as you've mentioned, both your reports are available in both BSL and in English. Could you pick out any highlights from your report that you feel are particularly positive, either with councils or NHS boards? Any examples of good practice, anything that you think is particularly positive or indeed particularly negative? Yes, from my experience, Dundee and Angus, those two councils, so that's Dundee City and Angus, yes, Dundee and Angus, they pooled resources in order to provide a service supporting young people. And they have appointed a number of young people as apprentices, and they're training them to become translators and to provide information to deaf communities. And they've taken on 6 apprentices, which is fantastic. And also in Dundee in 2019, 2020, around about then, they brought on an apprentice. They initiated an apprenticeship for young deaf people, and those young deaf people have recently been made permanent. They've been given permanent positions, which is absolutely fantastic. If we go over to Perth and Kinross Council, so let me just clarify, that's Perth and Kinross, indeed, that's right, Perth and Kinross. They have a number of BSL videos, particularly in the arts and culture sector, looking at guided tours around museums and information and so on. So those videos have proved very, very popular. So when you're talking about culture there, Helen, you're talking about information about local events or things that are available in the area, like the turning on of Christmas lights and that sort of thing. Indeed, so absolutely so. Yes, exactly that. Exactly that. And also visitor attractions that people might want to go to in their leisure time. And they provide information about them in BSL, which is great. James, any positive examples from the NHS boards? Yes, we had one deaf person who wanted to provide a feedback to NHS 24. So we created a video in BSL that was sent to NHS 24. And the deaf person actually got a response in BSL presented by a deaf person with subtitles. So the original deaf person who had made that submission to NHS 24 thought that was overwhelmed by that. They thought it was absolutely fantastic. It was really, really good practice. Okay, so somebody has made a complaint in BSL and received a reply in sign language, and so they've got that choice. They've got options effectively. So you could write a reply, but you could send it in BSL and receive a reply in your own language. That's very positive, isn't it? That's what an amazing response from the NHS to make the effort to reply in British Sign Language. That's incredibly positive. And more examples from the NHS, James? You look like you have more. Yes, in Fife, they have deaf communication services, which they've established there, which means that if anybody wants advice or needs an interpreter, they text this service directly, and the service will text them back saying, we've got an interpreter booked for you, and this is the name of the interpreter. And that just reduces so much stress for deaf people going for appointments. In other areas, deaf people don't have that access and have to book an interpreter at every point in their healthcare journey. So this really resolves that issue. I understand it can be very nerve-wracking for deaf people who don't know whether an interpreter has been booked or who the interpreter is beforehand, and how much of a relief it must be for deaf people to know there's going to be an interpreter at the appointment and they know who it is. it would be wonderful if all NHS boards could follow that example and adopt that system. Just to get a text notification like that reduces so much anxiety for deaf people going on a healthcare journey. It's very important. Yeah. Helen, you wanted to say something? Sorry, could I just add first, I mentioned about the deaf person giving the feedback in BSL. This is also a good practice that I'd like to see adopted across all the NHS councils, to have responses in BSL in that way that feels so comfortable to the deaf community would be invaluable across all NHS boards, I think. Okay, we have a comment in from a viewer, which I'm going to take in a minute, but I'd like to come to you first, Helen. Do you have any other examples from your work? I do, yes. I want to give an example of a really positive example of a local authority engaging with the deaf community, and that's North and South Lanarkshire. They set up an advisory group, and they organised engagement with local deaf clubs and with Deafblind Scotland and with a number of stakeholders, and discussed their plan and asked for advice, and really just empowered the local community in making those plans. Yes, NHS Lanarkshire have been proactive in this way as well. Really great in getting deaf people involved in an advisory board. Instead of kind of going out and meeting deaf people, which of course can be quite intensive and use quite a lot of resources, they've brought deaf people in to form an advisory group, and they just have one meeting, a regular meeting with those partners, with those stakeholders, and they work in partnership with them, and it's really, really positive. Yeah, if I could say the same thing about Fife, really, NHS Fife and the council and the education and the police authority, I think, I'm not sure about that, but I think the police authority is involved. They've pooled their resources and they're working together. I mentioned the Fife Communication Service, or you did, James, and that has been a result of that. They also have an advisory group, and hopefully we'll see more models like that going forward. Yes, this idea of establishing forums or working groups that involve deaf people, not just one deaf person, but a number of deaf people representing various aspects of the community is very positive, isn't it? We have a question that's come in from Alison Hendry. Maybe this will be covered later, but do you think the council and health boards will continue to work by themselves, or will there be collaborative working with other public bodies? I'm just thinking of the example during the consultation period where Lothian public bodies came together, Council, NHS, University College. James, you've already mentioned the idea of the effort involved in reaching out to all of these various deaf communities, whereas in fact you could bring people in to one advisory group. And I suppose that really answers Alison's question, at least I hope it does. Yes, remember, but in the days before the bill, the government didn't consult with deaf communities. And I think you remember during that consultation period before the bill, there was a lot of Facebook consultation, a lot of activity, and that's what eventually led to this plan. There is a kind of consultation fatigue, though, that I think deaf communities can experience, even though their feedback is very important. So I think this model of setting up one consultation group just reduces that consultation fatigue and makes it easier. It also helps to engage, doesn't it? I'm thinking about some of the councils who have worked together as hubs almost. Indeed, Ayrshire, South, East and North, and the Pan Air Councils, and I think the NHS Ayrshire as well. Yes, Ayr and Arran. They have all grouped together and they are pooling their resources to develop services, and that really seems to work very well. I've already spoken about Fife. Dundee as well is working collaboratively, and that does seem to make it much easier. Okay, so we've dealt with examples of good practice. And like Alison says, this idea of collaborating is very effective because obviously we're all working to the same aim. When we're talking about deaf communities being over-consulted and experiencing consultation fatigue, being consulted about health, being consulted about local authority services, being consulted about police and so on, and that is a risk, isn't it? So that is something to be conscious of going forward. Thank you, Alison, for bringing up that comment. Do we have any other examples of good practice, James? Yes, as some people may be aware already, the NHS of Greater Glasgow and Clyde, NHS GGC for short, have established their own BSL health campaign group, which creates information videos to put on their website. And that's a great example of what can happen when you empower deaf communities and work collaboratively with deaf communities to find out what's important for them and to get the information out there. So I think that's a very empowering model. I'd like to add to that, James, if I may, sorry to jump in, but Greater Glasgow and Clyde, I think, have employed 2 or 3 deaf people to work with them for that, haven't they? Yeah, they have, that's right. They have 1 deaf person working under the NHSPC, sorry, the Health and Social Care Partnership. So there's a deaf person working under their auspices and working in collaboration with the Greater Glasgow and Clyde Authority, and they're doing really well. It's working very effectively. So bringing deaf staff on board is one very positive way. It is, absolutely. And so is that only happening with health or in councils as well? There's a lot of consultation, I think, isn't there, as well, going on? Yes, that person's responsible for doing a lot of consultation with the deaf community in the Greater Glasgow and Clyde area. And with Inverleith mental health services as well. But is this also happening with councils? It is indeed. In various parts of Scotland, yes. Also, of course, the Scottish Government has been funding the police to improve so the access to services there, the Scottish Parliament, college and universities, as Alison said. I know that Alison is, her post is as a result of that. So we are seeing more and more deaf people being employed in these services across Scotland. Indeed, we are. We need more. I'd like to add that Greater Glasgow and Clyde NHS also have a deaf manager, a deaf services manager. So any concerns or complaints from the deaf community in relation to services that are being provided can be directed straight to that person and can be dealt with by somebody who understands the perspective. And that's really important to have deaf people involved in this service at that level. The third thing I'd like to say is that, oh, now I've forgotten what it is. So we were talking about more and more deaf people being involved in these services and that being a very positive thing, and hoping to see that progressing going forward. I think the more deaf people are brought on, the more we're likely to see deaf people doing the translation and the presentation. That's right. So we get to see more and more deaf people fronting up these kinds of services and providing information. Yes, and I think in terms of outreach and attitude when engaging with deaf communities, I think that's very important. You know, we're getting interpreters with providing news and Yes, exactly. And certainly with coronavirus, the updates were interpreted every day. And I think that sign language has become more visible, and BSL access to services has become more visible as a result of that. James, could you talk to us a little bit more about that? Yes, BDA Scotland created a summary after every coronavirus update, news update. So we created our own BSL summaries. We also created our own coronavirus page, and we put those BSL summaries on the Facebook page. Obviously, we're aware that some people don't have access to the internet, so we also put them, disseminated them elsewhere. We created a true and false coronavirus video, doing a bit of myth busting around some of the rumours that were around at that time. We created a lot of information about vaccination, for example, and we kept that updated. So that was available on the BDA website, and we had a lot of traction. A lot of deaf people really appreciated that. Thank you. And it was thanks to the Scottish Government for allowing the BDA to provide those news summaries and make sure that that information was getting out to the deaf community in what was a very fast moving and very changing information environment. But we were able to do a cultural and appropriate translation, and deaf people were able to actually access that information in an appropriate and easy way. Those were mailed out every week. We sent all that information out to councils, to Nhs Boards, all of those videos and all of those links we created, we sent out to our partners on a regular basis. And I think that helped them become aware of why access in BSL is so important, and made them understand the need to translate their own local information. And they were able to share that information locally, weren't they? And they were able to therefore set up kind of pathways to do that. Okay, one more thing I'd like to come to. We've talked about positive things. Are there any areas of concern that remain? Obviously, it would be impossible to provide 100% perfectly accessible services all across Scotland, but do you have any great areas of concern? Well, as I said before, the Bsl Scotland Act is great in and of itself, but councils, I think, weren't aware that deaf people weren't happy with some of the services they were receiving, some of the processes to access services. And we did, in order to kind of help them, we created best practice so that they understood that some of the complaints they might be receiving from the deaf community didn't, were about pent-up frustration, and that they should continue to work towards providing good service. And how it was important that staff on the front line in councils were aware of deaf people, so that deaf people approaching the council, going to the council building or whatever, weren't met with a kind of offhand and phased response. So we needed BSL awareness training and knowledge about interpreters and how to book them. Yes, just on the back of that, talking about interpreting, both the deaf community and the health boards, I think, need to be, have brought up concerns about particularly the north of Scotland, Helen and Nhs, the Highlands. There are very few interpreters available. So if deaf people do want to access health services in those very remote and rural areas, that can be a real difficulty for health boards and local authorities alike. So we need to look at how we can increase access and services to those kind of remote and rural authorities. Obviously, in more built-up areas, access is more easy. But in the Western Isles, comme Helen Morganswenholt, it's obviously much more difficult. Where they speak Gaelic as well. Indeed so, absolutely so. So in these kinds of on Alien Sierra, there's a lot of remote travel between the islands, so it can be very expensive, it can be very difficult to access interpreting services. So there, obviously, remote interpreting services are going to be very important. Yeah, and as technology and technological access improves in the rural areas, we will be able to get more access to online services, but we need fast broadband, and we need those kinds of those kinds of infrastructures in place. So yes, in the north, in the highlands and the islands, it can be quite difficult. So there are issues around interpreting, but what about Contact Scotland BSL? Because they've had funding, haven't they, to provide this service? Yes, and that started some time ago. Deaf people throughout coronavirus have been using this service 24/7. I think it really came into its own during the pandemic, where deaf people were isolated, they couldn't phone their families and so on. And it became important, particularly in terms of health, right? Particularly, yes, during coronavirus, when everyone was in lockdown, it was difficult to travel, to see families and so on. People found themselves very isolated. Deaf community services were often shut. Hearing people, of course, in these circumstances can pick up a phone and have a reassuring chat with someone, but it's not the same for deaf communities who are trying to contact their hearing families. So services like Contact Scotland really came into their own. Also, when people were concerned if they might themselves have contracted coronavirus, Nhs 24 was able to talk them through symptoms, give them guidance. So this kind of access to services was invaluable. And obviously we've seen the numbers of people accessing these services rise really terrifically throughout the pandemic. Yes, in 1 month in July in 2020, there are about 3,000 calls. This July 2021, that had risen to over 4,000. So you can see the kind of increase we're talking about. Okay, so positives and negatives coming out of that in itself. Okay. So there are a number of concerns. Yeah, there's another concern that I have, which is around the area of engagement. And is this something that's included in the report? It is indeed, yeah. We found that a lot of local authorities were struggling with how to engage with deaf communities. They didn't know how to do it. So in the next 3 years, I think that really needs to be a focus. We really need to look at building bridges between deaf communities and local authorities. It may be that local authorities have drawn up plans without consulting with deaf communities, and the local authority priorities are not the same as the priorities of the local deaf community. So we really need to increase engagement. Yeah, and if I can add to that, particularly through coronavirus, that created more difficulties and more barriers for engagement. Deaf people couldn't go to their normal deaf clubs or usual facilities, and became much more reliant on social media. Now we've seen more and more sign language on social media, so there is increasing access in that way, and deaf people have been able to kind of ask questions. So social media has kind of stepped into the gap, really. And is that a long-term solution? I think really long-term, we need to be setting up events where we can bring together local services and deaf communities. In February 2021, we began sending out information about coronavirus vaccination. And we were trying to encourage deaf communities to come onto Zoom. We set up a discussion with various health professionals, a kind of question and answer session to clarify any issues people might have over vaccination. And these kinds of two-way conversations, I think, are absolutely invaluable. That worked really, really well. We also had representation from the government. Wow, so you could talk about health in all kinds of ways, and those conversations were interpreted. Yep, and in March 2021, there was a change in the law. Yeah, so deaf people needed to be informed about that as well. Absolutely, deaf people weren't sure where they stood in regard to that. So again, we had another Zoom platform conversation where we were able to bring deaf people and health professionals to talk, for example, about diabetes and clarify questions around that. So these kinds of fora, I think, are really useful. I've got an example of that with the FSA Food Standards Scotland. Deaf communities didn't have a clue who they were. They've created a BSL plan, and as a result of that, James, I know that you were very involved in that. Yes, and there's the link on screen now. Deaf communities began to understand what their rights were, that there were food hygiene inspectors, that there were rules and regulations about the preparation and selling of food. So really looking forward to more of that kind of information coming out and being disseminated in the deaf community. But the important thing is that it really is a two-way conversation that needs to take place. Yes, and we also found examples of good practice here, because particularly with the food standards, for example, on their website, they put a very clear logo, the two-handed BSL logo on the homepage of their website, which made it incredibly easy to navigate. It was one click to BSL information. So that was really lovely. I know that some other websites are difficult to navigate, even though they have that logo. They put the logo perhaps in a more obscure place, so it's more difficult for deaf people to navigate. I'd really like to see other health boards, other local authorities follow the example of the Food Standards Agency in the accessibility of their website, because it's just one click from that logo on the homepage to lots of information in BSL directly. Okay, we have a question, I think, coming in, and that's from Moira Ross, who says, Fab, I just wonder what percentage of deaf people throughout Scotland have given feedback from 2015 until now. And we've been talking about local authorities and Nhs Boards, and I think this might be a good time to bring up the question of the roadshow, which has been touring throughout Scotland to deaf people. You have an image of it there, and you have some information about it there, Helen. Moira was asking, there we are. So Moira is asking a question about how many deaf people have been involved, and you have a Venn diagram there. Can you talk us through that a little bit? Yes, we managed to put on 7 road shows. Obviously, coronavirus hit, so we couldn't get to all of the areas throughout Scotland, but we did do some Zoom road shows. So we covered the north, the south, the east and the west, and central Scotland as well. And we managed to engage Deafblind Scotland, which was very important. So, and also the Scottish Ethnic Minorities Council, who've been incredibly supportive. And altogether, we managed to engage 63 community groups. Again, because of coronavirus, we were planning to engage more people, but obviously the pandemic brought that to a close. And you've been doing one-to-one engagement as well? Yes, on FaceTime and through text and other platforms. And the roadshows themselves, as I say, we did 7, but we are planning to pick those up again and roll with those for the remaining 3 years, and hopefully we'll be able to get much more feedback. So coronavirus and lockdown meant that you couldn't really access deaf clubs. Exactly so. So you're hoping to do more face-to-face stuff after that. And I hope, Moira, that answers your question about that level of engagement. Helen, Before lockdown, I know that you went up to Inverness. Oh yes, that was a lovely event. It was just before lockdown, you're right. It was, yes, I remember it well, and it was fantastic. So hopefully it was very well attended. Hopefully we'll be able to establish more like that. And also Zoom has been effective, hasn't it, in engaging with other groups? Yes, it has actually. Although a lot of the people at the beginning weren't familiar with Zoom and other platforms. I think now we all are Zoom experts, aren't we? We all know how to do it. Although I'm looking forward, I have to say, to getting back to face-to-face engagement. Okay, we have another question coming in, again from Alison Hendry. What do you think is the best way of gathering feedback? As a group, drop-in, or one-to-one? Have prepared questions or let people share their views. I know you've already said about consultation fatigue, and it's better to gather feedback once rather than asking and asking. Well, I think these questions are creating more work for us, are they? Well, in the forthcoming 3 years, we're hoping that we'll be able to set up a helpline. I don't know if you want to speak more about the helpline that we're planning. Well, Helen and I will be available either through Zoom or FaceTime or WhatsApp, whatever is the most suitable platform. And we're hoping to provide a helpline that signposts deaf people to the appropriate service that they want to contact, whether that's a health board or other service. So people are welcome to contact us. We'll be sending out posters about this soon, and we'll be launching it soon. So that does relate to Alison's question, though, that feedback could be one-to-one, it could be in a group. The helpline is one solution to that, so that you get to talk to someone who can signpost you, and we can collate queries to specific health councils or specific health services, and BDA Scotland will provide this helpline. I have to stress, folks, it's not going to be 24/7, not like Contact Scotland. Perhaps in the future, who knows? But for the moment, it's going to be much more small scale, and we're going to assess demand as we go forward. But at the moment, we'll be providing that helpline for inquiries to councils and NHS boards. And councils and NHS boards are very big. They have all kinds of departments, social services, and so on, you know, a whole variety of services within a council, and that's the same with an NHS board. So it can be very difficult to navigate that. So really the idea of the helpline is to provide assistance at that point. So James, you mentioned, and I'm wondering if this will help Alison, you mentioned about having Zoom discussions, bringing in deaf people, gathering questions beforehand to pose to experts and so on, having prepared questions or and trying to solicit the views of experts. Can we talk about the different ways that we've gathered information? Does that, in answer to Alison's question, I don't know whether we've covered it. If not, perhaps Alison might pose the question again. I've got an eye on the time, and I'm wondering, in those road shows, obviously you were able to meet people face to face. Did you find common issues being brought up over and over again that were ringing alarm bells? Yeah. There was a lot of frustration in common about education and about school. Education, absolutely. Education came up again and again in terms of the quality of sign language provision for deaf young people through education. The provision of kind of communication support workers with level 1 or level 2, or teachers with those level of sign skills. So there's a lot of concern about excellence in BSL access within education, the provision of qualified interpreters, signing deaf teachers, deaf role models within education so that young people had access to information, had access to role models, had access to ambition. And really, we were looking at a lot of concern of deaf people being able to impart culture and the richness of the language to the next generation. It was really important. So you've gathered feedback from young people as well. Have you got any good examples of work with young people? Yes, Public Health Scotland set up a Zoom meeting with young deaf people. Now, this was in April when they were just beginning to talk to young people about vaccination, trying to encourage them to get vaccinated and talk to young deaf people about how to do that. And it was great. We worked together. They prepared questions. We got some young people along. And there's a video on the BDA website on our information page. You can find the video there. So there are lots of questions and answers. Again, this was a very two-way conversation. So they were able to engage with that. And it was a great way to involve young people. Yes, we need to think about including not just older people, but young people too. Yeah, and the Bsl Scotland Act 2015 going forward is going to be the inheritance of young deaf people, isn't it? So we really need to look at schools. We really need to look at education authorities. We need to look at their L1 and L2 policy, because, you know, they have this ability to have your L1 as English, your L2 as French or German or whatever. And what we'd really, or Scots Gaelic perhaps, and we need to have BSL featuring in that so that hearing children can learn BSL as their L2 going forward, so that in the future, when they come to college or university or studying to be professionals or doctors or whatever, they can take those skills forward into their work. Yeah, so they have a memory of that. So you're right, the young people now are learning sign language at a late age, when they've left school, when they've gone to college, when they're 25 or 30, training to become interpreters. But we have the opportunity now to get young people in primary learning sign language as their L2, and perhaps then in future going on to look towards work as interpreters or as professionals who sign. Yeah, care home staff even, for example, you know. Anybody in all kinds of professions might be working with deaf people and might find their BSL skills are useful. So getting those skills implanted in young people, both deaf and hearing, in Scotland at this stage would really change the future. Well, with the BSL Act, hopefully young people who were previously unfamiliar with sign language are now becoming much more aware. Young deaf people are becoming more assertive and able to stand up for their rights, feel empowered, and that the BDA DEF acronym, deafness, equality, access, and freedom of choice, becomes enacted, and young people, you know, importantly, are able to access and achieve those ambitions. We're running out of time now, but I'd just like to ask, do you have any examples of good practice that you didn't share before that you would like to share with our viewers today? Or anything else that you would like to bring up as a last comment, or anything that you'd like to share from your report? I think I've talked about everything I wanted to talk about. Of course, I think we're all going to go away and watch the videos and read the reports. But it seems to me that two things crucially have come up. One is engagement, the importance of engaging with deaf communities and not making decisions for deaf communities, and the BDA's role in building bridges between service providers and deaf communities. So I think that's very important, isn't it? Yeah, and I'd like to add to that, if I may, that empowerment training has been a very important part of that. So deaf people have felt in the past uncertain, unsure about how to contact these services, the best way forward. They have felt overpowered by very high levels of English that represent these service providers. So empowering deaf people to ask questions, to approach these service providers has been very important. And we've trained people in doing this. What is that, James? Can you tell us more about that? It's a particular way of providing feedback. It's called a feedback sandwich. It has 3 layers. So you start with something really positive about what the provider does. And then you say, however, it would be great if you could improve X, Y, Z. And then you say, you close with something positive. And so you say, but, yeah, and that helps engagement, doesn't it? Absolutely. So rather than just a wall of complaint, it forms a way of engaging with authorities and service providers. So if deaf and hearing people are trained, empowered in this way, then they can approach service providers without being destructively negative. Yeah, and it helps to find solutions. It shows that you want to work together, doesn't it? And that's really important. So that feedback sandwich is a good way of starting people thinking about how they approach these services critically but positively, and in a way that the service providers can appreciate and build on. So yeah, engagement is one area that I think is crucial to improve going forward. There are examples of engagement, but we need more. And the empowerment training to make sure that deaf communities are able to engage when these opportunities present themselves. So they're able to build bridges with service providers. So they're not nervous about approaching service providers. They're empowered. They know how to do that. Yeah, how to book interpreters, how to kind of make sure that they can deal with the ways that hearing people communicate, their hedging and so on, rather than being too direct. And also there's an issue, isn't there, about staff turnover and how to hand over information. Yeah, absolutely there is. And so we've written some guidance on that, how to work with deaf communities, how to book interpreters. So we've got written guidance on that can be passed and handed over. So it's really important to kind of future-proof with those kind of handover documents and that sort of documentation, so that anyone new coming into a post inherits all of the good work that has been done so far and can continue it, instead of, going back to square one, reinventing the wheel and so on, and having to re-engage with deaf communities and ask the same questions. And again, inducing that sort of engagement fatigue. Okay, I think we've just got time for this one more question. So this is a question from David Buxton. How far has the Scottish Government invested in the Early Years project to promote BSL at home for families and deaf children aged 6 months to 4 years? That is a good question. That's a great question. Thank you for that question, David. It's a really good question. It's a very important area. So in relation to early years, there's always more to be done. I think it's a big area of concern. And we've been thinking about ways of promoting the learning of and the use of BSL at home. In the recent election, you may remember that we had a number of MSPs standing, one in particular, on a mandate of offering BSL courses. So hopefully that in itself increased awareness of the need for BSL at home. That's a great question, and I can't actually answer it. I don't know if either of my colleagues can really answer that, but that's something that we can take forward to the Scottish Government and ask about that. And hopefully we'll be able to answer that later, because we do have education as part of that engagement with local authorities. Hopefully we'll be able to bring back education responses to that question in coming months. Yeah, and We have engaged with councils, and that's a question we can add to our work ongoing with councils, ask them about what they're doing with early years, with nursery education, and with pre-nursery when children are at home. What are they doing to engage and promote sign language in those areas? Because you're right, it's very important in terms of safeguarding the future of our community to make sure that those links are available from the cradle onwards. So thanks for that. That's a great question, David. And I have to say, you're not the first person to raise that question. So that is an area we need to look at. Yes, that's perhaps something we need to prioritise in the coming 3 years. I know, but that has been an hour already. Thank you. I think that's been a great discussion. In summary, I want to say that in the next 3 years, BDA Scotland would like to thank again the Equalities Commission of the Scottish Government for funding us, for ongoing work in this area, so that we can launch our helpline, so that we can continue to engage with local authorities and Nhs Boards. And it's really important to get deaf people involved in this process. Yeah, the empowerment training, I think, is really important. So I guess watch this space in the next 3 years. Any final comments from you to our deaf communities or anybody watching us today? I'd just like to say it's been great engaging with deaf communities and the councils. We've had very rich engagement, so I'd like to thank everybody who's been involved in that process so far. Yeah, we're still here, and we're looking forward to the next 3 years, and we're looking forward to improving that engagement with councils and health boards. Please do get in touch with us. Please do contact us. We're really happy to support you in any engagement activity that you'd like to do going forwards. And hopefully by the time we get to 2025, 2026, our local authorities and our health boards will be fully engaged with British Sign Language. Absolutely. And the three of us will be working very hard to lead engagement on that. Anybody who's putting together their BSL plans, anybody working to implement their BSL plans, please get in touch with us, and we can help and support you with that. In the meantime, thank you very much for watching. Don't forget, those reports are available both in BSL and English on our website. They're open to the public. They've been uploaded this week. So please do read and enjoy. The link is available at the bottom of your screen there. And thank you very much for engaging with us today. Thank you all. Take care. Bye.